Hello, everyone. My name is Jawad Parvizi. I'm a professor of orthopedic surgery and I practice in Acıbadem University in Istanbul. I have the distinct pleasure of talking to one of the giants in the field of orthopedic infections, Professor Martin Klaus. He is currently the president of the European Bone and Joint Infection Society. He's been a great educator and a friend for many years. He was also part of the executive committee for international consensus meeting and helped us and guided us during the 2 year process that led to the May meeting in Istanbul. Martin, thank you so much for making time, especially I know this is really late in Switzerland. Thank you for being on this podcast.
Thanks, Parte, to hosting me.
It's a pleasure. So, Martin, what do you think is going on with orthopedic infections? Are we making progress? Are we standing still? Where are we?
Well, I think in the last years there have been a lot of good developments, but what I think is the most important step which was achieved in the last time is the development of a unified PGI definition, which is to come soon, which was a development or is a development of ICM, EBGIS, IDSA, MSIS, and the SGI, the ESCMID, so the five big players in the field. And I think this is something which is unique because the big advantage is that we have a definition of PGI afterwards, which will harmonize the whole research in the field.
Yeah, and that was presented by Marion during the ICM process. It was fantastic. I think people are very, very excited. And as you said, hopefully that will come out very soon. In terms of like doing research in the field of PJI, it's always very difficult to get these multi-center randomized prospective studies completed. And it doesn't mean we haven't done, our field has seen many, particularly some of those from Europe. In your opinion, what are the areas in need of desperate need of research? Diagnostic criteria was one that you mentioned. Can you think of other areas where we need to be diving in deeper and trying to generate more evidence?
Well, what is, from my perspective, the logical next step would be to produce a kind of classification system like the FRI groups have produced, meanwhile, under the guidance of Willem Metzenmakers and Mario Morgenstern and the whole group. And I think that is important also for PGI research to have that classification system. Otherwise, you're comparing apples and pears. And at least at the moment, it looks like as the whole group of societies, or at least ICM and EBGIS, maybe MSIS, are willing to proceed in that direction to develop also a classification system, because then you can make research more comparable and find the so say the weak areas of our treatment at the moment.
Yeah, that's a fantastic point. Exactly. I think that's part of our problem is we don't really have any type of prognostic classification for these. Are you hopeful about the future of orthopedic infections? Are there things that you're excited about that are being developed at the moment?
Well, there are new trends in the diagnostics. For example, NGS is something which is coming in the field, which is getting more and more important. Even though I believe that the role of NGS in the field is not well defined yet, I think it's not necessary to do it in all cases, but the definition on what cases and when and how to implement it in definitions or in diagnostic algorithms is something which is of importance. And when you were asking, am I happy about the field? To be honest, not really, because there's a lot of problems coming with the multi-drug resistant, the gram negatives. We in Europe we see more and more of them coming over from the Ukrainian war from the east. So that's a big problem. That's something I'm really afraid of. And I believe that there should be or must be initiatives taken also from the big players in order for an antibiotic stewardship and to get in control, because the pharma industry will not give us new magic bullets for fighting these problems. So
Yeah.
there's one positive and one negative, or something which I'm a bit concerned about. But let's see. I think in the end, we will find a way through it.
Yeah, thank you for your insightful comments. It's always a pleasure to talk to you. And thank you for your leadership, your dedication. And the exciting thing is that the MSIS and EBJIS are going to have the combined meeting in Porto in September, which I'm very excited about. And hopefully, we will get together, learn more from each other, and try to move this field forward, which is what ICM was trying to do. And it was great to have you at the ICM, and thank you for your leadership, and thank you for being such an active component part of this. I hope you're keeping well. I know you have a lot on your plate. Do you have any last minute words for our listeners?
Well, yeah, you already mentioned there will be a thrilling project for EPGIS and MSIS, the first combined 2026 meeting in Porto, which I hope will be a big success. We this year in Bologna already had more than 1,000 participants from all over the world, 56 countries, people coming over. So I hope that next year even will be bigger, and we will have a big part of the meeting reserved for debates comparing the Northern American or especially the US approach and combine it with the European, and elaborate the field of what is the same, what is different, and why is it different. So hope to learn a lot from each other and bring us a bit more connected to each other.
Fantastic. Looking forward to the meeting. Thank you again for making time, Martin. Have a good evening.
You too. Thank you, Jay,
Thank
for
you.
hosting.
Perfect.
Bye.
Thank you so much, Martin. Have a great day.
Bye.
I appreciate it. Bye.